All right, everybody. Well, welcome to our annual interview prep session. So this is a presentation that the Medina Clinic does every year to current APs, as well as current externs, in order to basically do everything we can to prepare well for the interviews. Now, I will say that a basic assumption for our get together today is that preparing for interviews is beneficial. So one approach is to say, well, I'm just gonna do my best, and I'm just gonna go in there and do it. So at the Medina Clinic, we disagree with that. Okay, we disagree with that. We believe that um, preparing for interviews is important and it makes a difference. So, and so today's session is how to prepare. All right. We're going to share a method that it gives you a framework for how to prep, how to prepare. Now, prepping for an interview is very different than practicing for an interview. Okay. So we're going to talk about how to prep. And then after we talk about how to prep, then there's practicing, which is something a little bit different that we're going to emphasize this year compared with last year. So, and we'll talk more about that as far as that practicing part, that practicing phase. We'll talk more about that at the end. But right now, we're going to talk about, for today, we're going to talk about how to prep, like how to get ready for the questions. That's what we're really talking about, how to get ready for the questions. Then you need to practice answering the questions. And then actually comes the interview itself where you can perform. Now, interviews, I want to say, are very, very critical. They are critical. So usually when it comes to this part, when talking with the assistant physicians, like I don't sugarcoat it. Like you need to nail it. Okay. I just want to make that very clear. You need to nail the interview. Because when you get the interview, you're more or less like everybody else. Like it doesn't really matter at that point, like what med school you went to, how many years you're out, or whatever. Like if you're at the interview, you're more or less in the same category as everybody. So you need to use the interview to separate yourself from the other candidates. You have to do that. And like I said, like at this juncture, I don't sugarcoat things. Like if you're getting interviews and not matching, you know where you need to focus. It's the interviews. Okay. Like if you are getting interviews and you are not matching, it's the interviews you need to focus on. To be very clear, you need to focus on that. So hopefully this will be helpful. I mean, I will tell you that this method of preparing, like I've used it myself. And look, I'm an international medical graduate. I went through the residency process. I had to go through it. And this is the method that I used to prep. And I think it was very helpful. And this is the method that we've been kind of teaching for bridge to residency participants. So I think that if you do good, like if you do good in an interview, there will be opportunities that maybe you feel like you don't have a shot at, but because you interview really well, you'll get it. Likewise, if there are opportunities you think you'd be a great fit for, you're very well qualified for, but you don't interview well, you're not going to get it. Okay. So the interview is like everything. That's why this is so important. Any questions so far? No? Okay. I will say that one previous experience that I had is there was one AP who was, we talked about the interview prep and we talked about, how to prep and all that stuff. And when I asked her, I'm like, so, did you prep? She's like, oh, yeah, I prepped. I'm like, okay, so you feel like you got it? Oh, yeah, I got it. And she never did any one-on-one, actually. She never did one-on-one. And then I'm like, okay, you feel like you got it? Oh, yeah, I got it. Now, for those of you who are in education, in any form of education, anytime someone says, "Oh yeah, yeah, I got it," you're like, "Yeah, I don't know about that." There's no such thing as, "Oh yeah, yeah, I got it." It's like, what do you mean you got it? What do you mean you got it? You interviewed last year, you didn't get it. What do you mean you got it? I mean, come on. Like, let's have a sense of urgency here. And then she went through and she didn't match. She didn't match. And then I would ask her, I'm like, so like when they asked you this, what did you say? She said, "Oh, I said this and I said that." And I'm like, are you kidding? Like you didn't say anything about being an AP. Like they asked you that question and you didn't say anything about being an AP. That tells me you didn't get it, actually. So this brings me to the other point. It's like, are we serious or not serious? Okay, like we're all trying to apply for residency here. Like, are we serious or not? Because it's like that's not what I'm expecting. I'm expecting, oh yeah, I'm gonna prep and I'm gonna do everything possible. And when it comes time for the interview, I'm gonna make sure I mention that I was an assistant physician. And in this case, she didn't say anything about being an AP. It's like, well, no wonder it didn't match. And then the next year, she again was not going to prep again. And then I'm like, I'm sorry, you need to sit down and we need to do some mock interviews or something. Like this is ridiculous. And then she kind of improved, and then she matched. So I'm just saying, like the interview is very critical. All right. So that's it for stories. Any questions on that? Okay, so let's move on and let's look at the agenda items for our session today. So first of all, you need to be able to answer the question. Like you need to know what is the number one question they're trying to answer. So we'll get to that. The next thing we'll talk about is nonverbal communication. So let me tell you another story, actually. So Dr. Bina, she volunteered with us. She has the record for the longest time she volunteered with us before she matched. She volunteered with us for 7 years. Can you believe that? 7 years she volunteered with us. Every year she would apply and she wouldn't match. Every year she would apply and she wouldn't match. And then, like, then we started to get the interview prep a little bit more well developed. And then it was last year, actually. Last year, actually the year before, we were trying to do interview prep and she couldn't make it because she was busy and working. So we weren't really able to do it that well, and she didn't match. And then last year, like then we hit it hard. And then when we did the interview prep, I'm like, Bina, like, I'm sorry, honey, you need to smile. Like, I'm serious, you need to smile. I mean, like a lot of the stuff is on Zoom and oh no. Like I'm watching you. You need to smile. You need to be more like bubbly or something. I mean, smile a little bit. So then when we would prep, I'm like, Bina, smile. Like I'm serious. You need to smile. Show those teeth. And she did that. And then so that was the prep that we did. And then the nonverbal communication is really important, okay? 80% of your communication is nonverbal, okay? Just remember that. Most of your communication with other people is nonverbal. It's not what you say, it's how you say it. My wife reminds me of that often, actually. So it's not what you say, it's how you say it. So you can say something, but if you're agitated, then you're agitated. I mean, it doesn't matter what you say. Or if you're not smiling, you're not smiling. Doesn't matter what you say. So your nonverbal communication needs to be excellent. It needs to be excellent. So we're going to talk about that. The other thing, so you can feel like you're good. You can feel like, oh, I said the right things. Yeah, but how did you say it? So nonverbal communication, very important. Like, here's another thing. Were you confident? Were you confident when you said your answers? Were you sitting up straight? So stuff like that. Were you confident? Were you smiling? Were you passionate? Stuff like that. Okay, so that's nonverbal. Then the actual method for prepping, we'll talk about that. And then some extra topics. We'll talk about how interviewing is actually a two-way interview. You're interviewing the program as well. Um, excuse me. Excuse me. And then extra topics, some extra miscellaneous topics we'll talk about. Okay. So that's really our agenda for tonight. All right. And then at the end, we're going to talk about the next phase, which is practicing. But any questions on this set of objectives right here? I think in the past, if anybody has looked at our YouTube videos in the past, they were for like 2.5 hours. And I don't think it's going to be quite that long because we're gonna, like I said, because we're gonna focus on the practicing portion, which is after tonight. We'll focus on that a little bit differently, more directly. We'll hit that harder. So actually, we won't need to spend practice time during this session. So it'll be a little bit shorter, which I'm sure everyone will appreciate. So, okay. Are we good to move on? Any questions? No? Okay. All right. So, good. Next slide here. So, okay, guys, let's try and get this a little bit more engaged with everybody, kind of chiming in. What is the number one question residency programs are trying to answer? Who wants to answer that?
Me.
Who was that?
Fatma.
Dr. Fatma. What is the number one question when they interview that they are trying to answer?
Why will they pick us, but not the others?
Not quite. Oh, well,
Really?
It's on the right track. It's on why you and not others. I mean, that's basically right, but what's another way to word it? There's another way to word it. Dr. Ike?
If you're somebody they can work with.
Somebody they can work with, okay, kind of the same thing, but what more directly? What are they trying to answer? Yes, Dr.
Are you a perfect fit for their program?
Are you a good fit? That's what they're looking for. They're not looking for, are you the best doctor? They're not looking for, do you have the best resume? Do you have the best research? Are you the nicest? They're not, no. They're looking for, are you the best fit for us? Okay, we're a program with specific characteristics. Are you good with us? Are we a good match? That's what they're looking for. Are we a good fit? And just like Dr. Fatima said, like, are we a good fit? Why would we pick you as a better fit than someone else, for example? Or like Dr. Ike said, like, why would we be better working with you than somebody else? The way overall, the overall question, the umbrella question is, are you a good fit for us? We're urban. Are you a good fit for an urban program? We're rural. Are you a good fit for a rural program? We're diverse. Are you a good fit for a diverse program? We're not diverse. Are you a good fit for a non-diverse program? We do a lot of this, but not a lot of this. Are you a good fit for us? We are very independent. Are you going to be a good fit for us? So you see, programs are different. They're not the same. And what they're looking for is, are you a good fit? That is the number one question they're trying to answer. So just keep that in mind. Any questions on this? No? Okay, so that's the first agenda item. That number one question, are you a good fit for the program? Now, what does a successful interview look like? Let's put it this way. Like, number one, you don't want to be rambling. Okay. You don't want to be rambling. And number two, you need to be engaged. You need to be engaged with the interview. And that's having really good body language. All right. Those are kind of the things. But there's some other things too. Like going back to the non-rambling thing. Don't ramble. Okay. You don't want to do that. A good interview looks like you giving good, concise, solid answers. Concise. So concise, solid answers that make sense. And you're doing it in such a way where you're having like a conversation with the interviewer, like they're a colleague, basically. Like it's a collegial conversation. if you're able to have a collegial conversation with giving solid, concise answers that make sense, and it's concise in such a way where you give your interviewer ample time to talk, your interviewer has ample time to say what they want to say, and you say what you want to say, that means you're not dominating the time. That's bad. Like if you're dominating the time, that's bad. Like if you're rambling and dominating, like taking too long, again, that's bad. So you're giving concise answers, solid answers where you're using up some time, but you're also giving your interviewer ample time to say what they want to say and ask what they want to ask. So it feels like a collegial conversation. Okay. So that's how it looks like as well. And then, of course, the other thing is that excellent nonverbal communication, which we'll talk about in the next slide. I will say in previous years, what I would say is that I would say your interviewer should be talking a lot more than you. And I got a lot of pushback on that, actually. And, some people say, well, what if you have a lot to say? And, to that, I would say, like, you're just entering residency. You don't have a lot to say. So I think that offended some people. But when we got previous people that matched, that they kind of modified it by saying it's a collegial thing, and it's true actually. So this year we're modifying a little bit by saying it should be a collegial conversation. And by collegial, it means, but still, they need ample time to talk. You need to give your answers in a good, concise way, and it needs to feel like a collegial conversation. And I would say, Dr. Ishraf and Dr. Zach, what you might want to do is set up a separate session with some folks that have matched last year. Maybe Dr. Sartak and Dr. Itoro, you might want to do that actually. Dr. Sartak and Dr. Itoro did that last year. They set up a session, and I wasn't there, which is good. You don't want me there, but set up a session with Dr. Sartak and Dr. Itoro so you can get their impressions too. So that would be good. So okay, so then there's So now let's talk a little bit more about nonverbal communication. But before we do that, any questions on this? Anybody? No? Okay, so now let's talk about nonverbal communication. Okay, this is really important. Like when I saw Bina last year and how she was answering the questions, I was like, oh, like no wonder you didn't match. Like you need to smile some. I mean, come on, man. This is a professional interview, okay? You know what it means to be a professional? When you're a professional, that means you're good at everything, okay? You're good at everything. You're not just smart. It's not just, it's not just, you know the book stuff. It's not that. It means you know how to carry yourself. You know how to talk. You know how to communicate. You know what I mean? You know how to engage people, all right? That's what it means, So being a professional means you're a good communicator. And that's what you kind of have to do here. So for me, when I think of good nonverbal communication, I think of this list, okay? First of all, you need to sit up. Do I even have smile? Yeah, I do. Thank goodness. Okay, so the first thing is sit up straight. You need to sit up straight, all right? You need to have confidence. And that's the other thing about being a professional. You need to have confidence. And look, I'll be very honest with you. Like when I was in training, I didn't have a lot of confidence. Actually, I needed to build that up during residency. And let me tell you something, residency is a difficult time, okay? And it's such a difficult time that, when sometimes people don't match, you know what I tell them? It may have been good you didn't match. I'm serious. Because if you match and you do badly, it is horrible. Like your whole career is affected. you know, like if you match into residency and you do badly and they put you on probation, you have to report that probation for the rest of your life. Like when you apply for licenses and when you apply to be on staff at hospitals and things like that, like you have to report that. And like, it's a problem. Like you do not want to fail in residency. You don't. So when sometimes people don't match, it's like, that's probably a good thing. You know, it really could have been, because you're better off not matching now, match later and succeed. Better than matching now and then you fail. Like that's not good. So residency is hard, and to do well, you need to be a good professional. You need to know how to communicate. You need to know when things aren't going well, how to keep your composure. You know, you need to know how to work hard and smile at the same time, kind of thing. Like that's what residency builds in you. Okay, because it's not easy. So you need to at least have some of that when you're starting residency and when you're interviewing. So part of it is confidence, you know. You know, when it comes to nonverbal communication, part of how you show confidence is sitting up straight. So sit up straight, people. Just sit up straight. And you know what? Even if it's uncomfortable, maybe you're interviewing in person, maybe you're interviewing on Zoom. If it's uncomfortable, I don't care. I don't care. You need to sit up straight, okay? And when you sit up straight, the other thing that you need to do is maintain eye contact. Now, this is very uncomfortable, actually. It can be very uncomfortable, but you need to look at that person in the eyes, okay? And like, I know it's uncomfortable, but I'm sorry. Like, I don't care. You need good nonverbal communication. You need to portray confidence. You need to show that you're engaged. And this is what you got to do. So this is especially if you're in person, you sit up straight and you look at the person in the eyes, okay? Now, if you're in front of the computer, you just look at the little camera thing. You look at the little camera thing while you talk. And I can tell you from experience, it's pretty effective when you look straight at the camera. Actually, I feel like it's better because you're not looking at the person's face. I personally get distracted when I look at the person's face, and it kind of throws me off during meetings sometimes. So look at the camera and talk. All right, like I'm looking at the camera now. I'm looking at it right now. I'm looking at the camera and you talk. And when you do that, you're so much more engaged, okay? Try not to look at the person on the screen. Try not to look around. Look at the camera. Look at the camera, sit up straight and talk and smile. Smile at all times. If you don't feel like smiling, I don't care. You need to smile, okay? Because you need to show that you are a professional, okay? And they need to get the feeling, wow, I get along with this person. I'm sure patients will get along with this person. I'm sure all the other residents and all the other faculty will get along with this person. So you sit up straight, you maintain eye contact, and you smile. And if it's uncomfortable, tough. You need to practice, okay? So when we practice, that's what you need to be doing, all right? So again, sit up straight, eye contact, smile. That's the non-verbal. So whatever you say during the interview, I don't care what you say during the interview, you need to do this stuff regardless of what you say, all right? So Bina, who went 6 or 7 years, okay? And then like she was saying the stuff and the stuff was good, you know? But then like the way she was saying it was like, oh, no, this is not gonna work. So it makes a big, and she matched actually. Actually she and another AP, they matched to the same place in Milwaukee, Wisconsin, actually. So, yeah, so, okay. So again, this is your big three right here, your big three. If you don't remember anything about nonverbal communication, this is your big three. You sit up straight, maintain eye contact, and you smile. And for every question, for every answer you give, for every question, that's how you talk. Sit up straight, eye contact, smile, give your answers, okay? So that's how you need to give it. Otherwise, there's the normal stuff, which, you know, is dress professionally, obviously. You want to, that's an easy one. Don't mess that up, you know, make sure you dress professionally. And then hand gestures. So who has questions about hand gestures during the interview? Anybody? Anybody? Oh yes, Dr. Ueda. What question do you have about hand gestures, Dr. Michael?
Yeah, how does that come up at an interview at all? Because I can't imagine you making too many hand gestures while you're talking.
Yeah. Go ahead, Dr. Amaka.
So for me, that's a weakness. I talk with my hands a lot.
Yeah. Well, so Dr. Amaka said it was a weakness. She talks with her hands a lot. Anybody else have any comments on that? Well, oh yeah, please.
I hate weakness too. So yeah, I
Okay.
told.
Dr. Jamie?
I was wondering, Dr. Murad, is hand gestures also described as when you touch your hair, your nose, and things like that? Is that?
No, don't do that. No,
Yeah.
don't do that. No, don't touch your face. No.
Yeah.
Actually, when you touch your face, in terms of body, like if you read body language, whenever people touch their face, it means that they're anxious.
Yeah.
So don't touch your face, don't touch your hair, don't touch your nose, don't touch anything. No. And so that's bad. But when it comes to the regular gestures of the hands, actually, I might disagree. I don't think it's a weakness. I don't think it's a weakness. I think it's a strength, and it shows passion. So when you talk, you know, when you talk, you're able to give emphasis into what you're saying. Yes, Dr. Ike?
What I've heard about hand gesture is that it's a form of distraction when you're talking on a video.
So I think, you know, it depends. So like if someone is a very seasoned, experienced communicator, they're going to use their hand gestures to emphasize what they're saying. So for example, if someone says, tell me about yourself, I would say, I would use my hands in an open way. Like I would say, absolutely, I would love to tell you about myself. Whenever you have your hands open like this, that's a good thing. Like that shows openness. That shows like making a connection. And then and then you can use it to just like I talk with my hands a lot, and you can make it work. So you can, like, for example, someone says, tell me about yourself. Well, I'd say, well, you know, I would say my career, I would divide my career into you know, a few phases. My first phase is when I was doing A, B, and C. My second phase is when I was doing C, B, and E. And then my third phase, I was doing X, Y, Z. Okay. So you see, you can, if you use your hands in very deliberate ways, but you don't want to be doing this. You know what I mean? Like if your hand gestures are random, then yeah, I mean, that's not good. It's almost like, you know, when you have a pointer, like a laser pointer during a PowerPoint presentation. You guys know what I mean? Like if I have a laser pointer and I'm giving a presentation and my laser pointer, like if you look at my screen here, can you guys see my pointer? If I'm using my pointer, like, okay, you're going to sit up straight, you're going to maintain eye contact, and you're going to smile, and, you know, so that's bad. But if I say, you need to sit up straight, you need to maintain eye contact, you need to smile at all times, you see, that's orderly. So if you use your hand gestures in a very orderly way, you know, like use your hands like this. And then when you're making a point of emphasis, for example, I believe I would be a great fit for your program. You know, I believe I would be a great fit for your program. You know, something like that. You're making emphasis. Like if you use one hand to say, I believe I would make a great one. You never want to stick your finger up like this. You never want to do that. But you can say, I believe I would be a great fit for your program, or I believe I would be a great fit for your program. See, that's very orderly, okay? Or you're talking about something chronologically, this, then this, then this. And then, or you say, thank you so much. I am so happy to be here. You know, you have your hands, you have the palms of your hands up. That's all good hand gestures. So what I would encourage you to do also is you can talk to the APs that matched last year. Hopefully Dr. Ishrath and Dr. Zach will set that up. And they can give you some info about that. But basically from feedback from APs that, you know, that have interviewed a lot and so forth, generally they've supported the idea of using your hand gestures. The other thing too is that it can show passion. So if you're like, I love volunteering at the Medina Clinic, I have been able to get so much clinical experience. You see how that can make a difference, as opposed to saying like, you know, just like this, and oh yeah, yeah, and like not smiling. Yeah, I volunteer at the Medina Clinic. I see patients. Like, what is that? Like, what is that? Come on. Like, you sit up straight, look at the camera, you're smiling. I have loved my experience at the Medina Clinic. I've been able to take care of many patients with multiple chronic medical conditions, and I've been able to take care of them as their primary care doctor. This experience has really showed me that I would be a great fit for family medicine, and I believe a great fit for your program. Like, now we're cooking, right? Now we're cooking. We got the posture, the eye contact, the smiling, the passion. Like, now we're cooking, okay? So that's what you want to be doing, okay? And if you do that, if you're able to do that, then you can really separate yourself from the other people. Because now, like, you've got passion, you've got confidence, like, you're positive. And you're telling me about this amazing thing about being an assistant physician. You know, now we're gonna make some differences, okay? So so that's what I would say about hand gestures. I mean, you don't want to do too much, you don't want to do crazy stuff, but just like have your hands, if your hands pop up, by the way, your hands should not go to your head, okay? They should come to your shoulders, but when your hands go to your head, it shows like you're a little out of control, okay? Or it shows that you are bewildered, or it shows that you're overwhelmed. That's what happens when the hands go above the shoulders, okay? So keep the hands, have the hands in view. Don't have them out here. Don't have them up like this. That's too much. But have them, like, use them, but just don't have them go above the shoulders, okay? So any questions on those things? Okay. Okay. Yeah, good. And then modification for Zoom. Yeah, big thing is look at the camera. Don't look at the screen. Don't look at the screen. Look at the camera. Now, on this one, like, this is from feedback from APs that have matched, but I would definitely encourage you to verify that with other people, because I haven't interviewed for the match in a long time. But generally speaking, I mean, I do a lot of stuff on Zoom, obviously. And if I really am worried, like if I really want to really present myself, then I'm looking at the camera. I'm not looking at the screen. So, okay. All right, guys, ready to move on? Any questions? So nonverbal communication is huge. And you know what? When we do our mock interviews, I'm really going to be focusing on this. I'm going to be focusing on this, okay? Because you can really turn someone off quickly if your nonverbal communication is not good. So, all right, good? Any questions? Okay, let's move on. So now let's talk about prepping, actually. Okay, guys, these 10 questions you need to prep for. Now, this is also a modification from previous years. Previous years, we would just throw some questions up here and be like, here's some questions, you know, and then we would talk about how to prep. This year, we're still going to talk about how to prep, but these are the 10 questions you need to prep for, okay? These questions, prep for these questions, not one question more, not one question less. Prep for these questions, all right? Don't prep for 20 questions. That's a disaster. That's a disaster. Do not prep for 20 questions. You probably could get away with prepping for 3 questions, actually. If you prepped for these top 3 questions, that's your bare minimum. but just prep for all of these. If you prep for all of these, you'll be prepared for the interview. So these 10 questions, like write them down. So, but we're going to record this, so it'll be posted, but like, yeah, these are the questions you need to prep for, okay? So while you're jotting that down, now the question is, okay, well, how do you prep for these questions? What do you do, you know? So here's what I do. Okay, here's what I do. I write down my questions. Okay. So I'm like, okay, these are the questions I'm gonna prep for. All right, that's it. I'm just gonna prep for these. I'm gonna prepare my talking points for each question. And I'm gonna prepare 2 or 3 talking points for each question. And I'm gonna study those talking points, so that if anybody asks me those questions, I'm gonna rattle off those 2 or 3 talking points, okay? And I'm gonna study those talking points, and I'm going to practice those talking points. And when I practice those talking points, I'm gonna do it sitting up, good eye contact, and smiling. I'm gonna practice my talking points doing just that. And I'm gonna go through each question, and I'm gonna practice saying my talking points until I've got it down, okay? These talking points I need to have down, it's like you're studying for a test. I need to have it down, and it's not just I have it down, I need to practice delivering it, okay? And this is what politicians do, by the way. So you think politicians, you ask them a question, they answer your question? No, they just give you their talking points. So that actually, when you interview a lot, you feel like a politician, to be honest. So that's what you do. You're practicing your talking points. So you're gonna figure out, okay, what talking points I'm gonna have for each one. And you think about it, you're like, okay, all right, I think I'm gonna do this as a talking point. Okay, I think I'm gonna do this as a talking point. All right, cool. I got a couple talking points here. Okay, got it. Now I'm gonna move on to the next question. What talking points do I wanna say? I wanna say I'm an AP. I wanna say this is what I do as an AP. I wanna say, you know, this is an experience I had, or whatever, you know? So you're gonna come up with your talking points for each one, and then you're gonna study it. Now, I'm gonna tell you, it does not take longer than an hour. It might take like roughly an hour to come up with your talking points, and it takes roughly an hour to study your talking points, okay? And before each interview, you prep you go over those talking points and you practice them. So it doesn't take too terribly long. So for every question, I'm having bullet point or talking point number 1, number 2, number 3. And then I've got something here called cap it off. For those of you who have done this before, what does cap it off mean? Anybody? What does cap it off? When I say cap it off, what does that mean?
That's why I'm fit for the program. I'm
Yes.
fit for you.
Thank you, Dr. Ishrat. You cap it off by saying, and for these reasons, I believe I would be a great fit for your program. You need to say that, okay? You need to say that. So you say your talking points, and then you say, and you know, for these reasons, I believe I would be a great fit for your program. And if you say that like 2 times, then what do they have in their minds? That you're what?
Good fit for the program.
They're good fit for their program. Like Dr. Ishrat, you're interested in psychiatry. I'm sure there's something psychological there, right? Like you say it enough times, it's like power of suggestion. You say it a few times, they're like, yeah, I like you. Yeah, I think you'd be a great fit for our program, you know, if you just tell them. So that needs to happen, okay? So you prepare your bullet points, you practice your talking points, and then you practice capping it off. For that reason, I would be a great fit for your program. So you do this for every question, so that when you have your piece of paper, literally this can all fit on one piece of paper. All of it can fit on one piece of paper. 5 questions over here, 5 questions over here, 2 or 3 bullet points each, and then you just have a few notes for each talking point. And the other concept here is that for your talking point, you don't write it out verbatim what you're going to say. Don't write it out verbatim. Just write what is the general point you're trying to make. So one point might be, you know, I volunteer as an assistant physician, and these are the things that I do. So just say point number 1, I volunteer at the Medina clinic. I commute. I commute to volunteer every month. And then bullet point number 2, these are the things that I do as an assistant physician. And then bullet point number 3, I collaborate with a family physician, cap it off. For these reasons, I believe I would be a great fit for family medicine. You see what I mean? So bullet point number 1, I commute and volunteer as an AP. Bullet point number 2, here's the list of things that I do as an AP. Bullet point number 3, I collaborate under a family physician because you're applying, let's just say you're applying to family medicine, right? So these are very helpful talking points if you're an AP. And then you cap it off by saying, because of all this, I believe I would be a great fit for your program. Or you say, because of this experience, I believe I would be a great fit for your program. Okay? Any questions on this? There are 2 more points I want to make, but any questions on coming up with these bullet points or these talking points?
Can the
Yes,
points be more than 3?
Oh, so 1 sec. I think Dr. Israel had his hand up.
I just want to, like, like, if I'm working on a question, I feel like, what if I am making the right answer, like for my practice? What if I don't have the right answer, or like,
Yeah, that's very interesting. I think, you know, I would say probably in an interview, there's no such thing as a right answer. There's no such thing as one right answer. And I think I would say probably 2 points, actually, 2 additional points. Besides, there's no one right answer. Number 2, it's how you give your answer. You want to give an answer, but remember, nonverbal communication is 80% of what you say. So it's not so much what you say, it's how you say it. Okay? So whatever I say, if I'm positive, if I'm smiling, if I got good eye contact, you know, if I'm talking with passion, you know what? It may not matter what I say, as long as I say something decent. Okay? As long as I say something decent. So remember, most of the time, it's how you say it. It's not what you say. And there's no such thing as a right answer. And then I would make one more point, Dr. Israel, which is that these answers, whenever you're thinking of your talking points, you're not really thinking necessarily of answering the question correctly. Your talking points are, what do I want to highlight about myself? Okay? That's a very important distinction. This isn't a test. You're not trying to get a right answer here. There is no right answer, first of all, but don't approach it like a test, like, oh, I need to give a right answer. There is no right answer. This is an opportunity to talk about yourself. And by the way, just so you guys know, it is very rare where it's good to talk about yourself, okay? Like, most people do not want to hear you talking about yourself, okay? I'm sure you can think of lots of examples. Like, normally you should not be talking about yourself. Normally, you should be talking about the patients, the care, the organization. You know what I mean? You're talking about you're talking about the team. You're talking about the goals of the team, the goals of the clinic, whatever. You're not talking about yourself. This is different. Here you're talking about yourself. This is one of the few times in life where people want to hear you talk about you. So what you want to do for every question, you're gonna prep for every question. For every question, you want to think, what do I want to highlight about myself? So when they ask you, why do you want to match into the specialty? You need to think, okay, okay, fine, you're asking me about specialty. Okay, whatever. Or they'll ask you, tell me about your strengths. Tell me about your weaknesses, whatever. Whatever question they ask you, you need to be thinking, okay, fine, I'll address that question, but what do I want to highlight about me? What do I want them to know about me? I want them to know I'm an assistant physician. I want them to know, here's another point I wanted to make. All the stuff that you sacrifice to be an assistant physician, here's where it pays off. Now it's going to pay off because you're going to say, I commute, Dr. Israel, I commute from California. You're from LA, right? No, you're from Phoenix. forget. I don't know. The Southwest is all the same to me. So you're like, I commute every month. I commute from Phoenix, Arizona to Kansas City just so I can volunteer in a family medicine charitable clinic. Now, all that stuff that you sacrificed, here's where it comes out. So you're going to, and you want them to know that. You're going to know, like, oh my God, like I sacrificed all this stuff, you know, and I want people to know, you know, because I did all this. I worked so hard. So you're going to think some of your talking points will be, think about the stuff you had to sacrifice. Like I commuted, I volunteered, I had to check my inbox every day. I had to present to preceptors. I had to make sure I prescribed before they left. I had to make sure that I got my clinic notes done within 24 hours. Now we're talking about stuff they want to hear. All that stuff that we get on you guys for, now this is where it comes in handy. Okay, this is your time to shine because you had to deal with all this. Now you're going to say it. So when you say, I had to present my patient, I had to get my notes done on time, I had to call patients back with their lab results and discuss the plan of care. Sometimes they didn't speak English. We had to figure out ways around it. I had to check my inbox every day, and I had to be ready to come back in the next month to do it again. And you know what? I loved it. I loved every minute of it. And this showed me that I believe I would be a great fit for family medicine and a great fit for your program. Okay. It's almost like you say it out of a place of anger because you work so hard, you know? So anyway, and then we held you accountable. They're like, and if I did not get my notes done, someone talked to me about it. I had to make sure I get that. So anyway, you get the idea. So the stuff that you had to sacrifice, the stuff that you had to do, you're like, no, I want them to know I did this stuff. That's the stuff you're going to put in here. So when they say, why family medicine? Why family medicine? Because, you know, I volunteered, I commuted, I precepted, I called the patients. Tell me about your strengths. Well, when I had to call patients back, I felt that we had great conversations when we talked about the lab results. An area of weakness, I think, you know, when calling patients back about their A1Cs, I felt I need to learn more about diabetes. That's a great weakness right there. Now you're starting to answer the weakness question correctly, actually. You see what I'm saying? So when you say, I did this, and this is a strength, and this is an area I would like to improve on, what a great way to answer strengths and weaknesses. What a great way to do it. So, but you're highlighting, you're kind of being clever about it. You're highlighting the fact that you called patients back. You're highlighting the fact that you checked lab results. You know what I mean? You know, so every question you need to think how, you guys, who's on LinkedIn? Are you guys on LinkedIn? So
Yes.
those LinkedIn posts, they're like, oh, I was so blessed to be interviewed by this newspaper today. You know what I'm saying? You know, they're saying, oh, I was so grateful to be interviewed by the newspaper, but they're really saying, hey, look at this. I was interviewed by the newspaper. You see what I'm saying? It's called a humble brag. It's similar. It's a similar kind of concept where you're answering the question, but you're sort of slipping in the stuff that you do. You know what I mean? So when they say, tell me about a weakness, well, when I commuted to Kansas City once a month to volunteer, I felt that, there were certain presentations that were very challenging. And I feel like I would like to develop more experience with that. Look at what you're saying. You're saying you commuted. You're saying you volunteered. You're alluding to the fact that you have clinical experience taking care of patients with multiple chronic conditions. Look at all this stuff you're kind of slipping in there. And then you're saying, I would like to improve in this. That's how you answer that question. Okay. So that's what I would be thinking about. Did that answer your question, Dr. Israel? Okay. Now, before
Yes,
I
thank you.
forget, I know somebody else had a point, but there's another concept, and you know what? I needed to make another. I'm going to make another slide right now. I need to make another slide, actually. Hold on. This is important enough. I need to make a slide out of this. Hold on a second. I'm so sorry. I forgot to do this. Okay, guys, there is one list of stuff you have to memorize cold. cold. And let me see if I can get this. You need to have memorized all the stuff that you do as an AP. It's a list of about 10 things or a dozen things. Do you guys know what I'm talking about? You guys know what I'm talking about?
Yes.
Okay, you need to memorize this list cold. If you don't memorize this list cold, shame on you. Honestly, shame on you. Because when you are interviewed, you need to be able to say this stuff. By the way, I'm also, like in previous years, I've also been surprised at how often people don't mention the fact that they're an assistant physician. Listen, people, you better be saying this like from the get-go during your interview, okay? Like if you're not saying this, like you're in trouble, okay? You need to be talking about your experience as an assistant physician, but it's not just you're an assistant physician, it's this list. All right, guys, let's get this list going. And like I said, you need to memorize it cold. So when they ask you, what do? You literally go through this entire list, okay? So let's go through it. So if I'm an AP, I commute to Kansas City once a month. A lot of you guys are not local, okay? And when you commute, that is a big deal. That shows commitment, okay? That shows commitment. You know what I'm saying? Like, that's a big, big deal. So I commute to Kansas City once a month to volunteer in you can say family medicine if you're applying to family medicine. If you're applying to something else, you can say primary care. And both are true. Primary care charitable clinic. Okay. I need my bullet points. Why isn't this working? This stinks. Stinks. Okay, this stinks. This clearly is not the latest version. Anyway. Okay, so number two. Number two, you need to say that I see clinic patients. I see clinic patients independently and check out to an on-site preceptor. Okay. Number three, I complete the clinic notes. Number four, I prescribe medications. And you do, like, you need to highlight this stuff. Do you think medical students, other people that are applying for residency, do you think they've ever prescribed medications before? No, they haven't. Like, you need to say this. Prescribed medications. I order lab work. I order imaging. I see patients during follow-up visits. I participate in office procedures. Now, if you haven't yet, you know, it's kind of tricky because they'll say, oh, what procedures? You know what I mean? If you've observed a procedure, you can say that, you know, I participated in this procedure, even if you observed, but they're not expecting too much. So, you know, if like you haven't done any procedures yet, you can say, and if there are any office procedures, I'm expected to participate in it. You know, and if you're still volunteering with us, and they ask you, oh, what procedures have you volunteered? What procedures have you done? You could say, well, I haven't done any yet, but we do a lot of joint injections, and I'm sure I'll get that opportunity because I'm still volunteering. You know, so you can say it that way. So I participate in office procedures. I check my inbox every day. That is a big deal, okay? That's why we make it a big deal at the Medina Clinic. Other people believe it's a big deal too. So I check my EHR inbox every day. When you say this, then they'll be like, oh yeah, you understand some of the workflow of a resident, okay? Like when you say I check my inbox every day, they're like, oh my God, you're reliable. You're someone we can rely on for good patient care. That's what you're saying when you say this, okay? So I check my EHR inbox every day. Let's see. Am I missing something? Oh yeah, I follow up on lab work and call patients back to discuss results. Okay, so there's the 10. Am I missing anything, you guys? Dr. Ishrat, am I missing anything here?
I think we have covered.
Yeah, yeah.
Refill medications or something like that.
Yeah, yeah. I prescribe medications and refills. I think that's good. Good. Yeah,
What about calling patients?
yeah, right here. Call patients back.
Oh, okay.
Yeah. So this is the 10. If you want to add something else, that sounds good. But you need to memorize this. If you don't memorize it, shame on you. You need to memorize it cold, because when you prep, when they say, tell me about, maybe it could even be in tell me about yourself. You have one bullet point, maybe another bullet point, and then maybe a third bullet point is, as an AP, I commute to Kansas City once a month where I volunteer to see patients that are oftentimes complex in this charitable clinic. I see them independently. I do my note. I check out to an on-site preceptor. I prescribe medications and refills. I order lab work. I order imaging. I see patients during follow-up visits. I participate in office procedures as they happen. I check my EHR inbox every day. I follow up on lab work, and I call patients back to discuss the results. Can you imagine? Just imagine if you said this during an interview. Like, seriously, just imagine you're an AP. You automatically can say all this stuff. Just imagine if you say this whole, they're not going to interrupt you. They better not. Like, just imagine if you go through this whole list during the interview. I dare them not to rank you. I dare them not to rank you. Can you imagine you say all this stuff? How can they not be interested? How can they not be interested? How? And I think a mistake that APs sometimes make when they interview is they don't take this seriously. They think like, oh yeah, whatever. I do this. But no. That means you don't know what they value. They value this stuff. Like this list should be one of your bullet points. So just imagine you go through this whole list. They'll be like, wow, they'll be like, wow. So this list, you need to memorize cold. When we do our mock interviews, you better have this memorized. Like, we don't have time to not have this memorized, okay? Like, we don't want to be doing mock interviews and you don't have this memorized. It's like, man, come on. Like, what are we doing here? Let's come back another time when you have this memorized, okay? So, because it's all about preparation, all right? So here's what we're gonna do. After tonight, we're gonna post this on YouTube. After tonight, you guys are going to text me and we're gonna set up some one-on-one time. And I'm just gonna ask that you text me, all right? Just text me. We're gonna set up some one-on-one time. Before we do that, and it's actually like 1-on-3, actually, just so you know. So because there are a lot, there's like not enough hours in the day. So I might take 2 or 3 APs and we'll do a session together. And actually it'll be helpful. It'll be doing a mock interview and I'll give you feedback and other people will give you feedback. And as other people give you feedback, it's also helpful for them too, as well as helpful for you. So it'll be like 1-on-2, 1-on-3. We'll try not to make it more than 3, but we'll see. So you're gonna text me a time, or you're gonna text me to try and set up a time, probably for like an hour or like an hour and a half. Oh, somebody texted hold on. Somebody chatted something. Telemedicine? Telemedicine? Oh yeah, sure. Yeah. Dr. Jamie, what can you explain to the group your suggestion?
Dr. Moral, I was thinking about calling patients through telemedicine and talking to them and giving the continuity of care.
Yeah. I even did telemedicine visits.
Yeah.
Absolutely.
Also, I believe we also do referrals. If that is,
Yeah.
do you think if it's important?
I do.
Yeah.
Yeah. Absolutely. Yes. refer to specialists.
Yeah.
I knew I was missing one. See, I should have memorized it cold, right? So, okay, there we go. So there's your dozen things, actually. Yeah. Okay, guys. Okay, dozen things.
Sorry, is it necessary to emphasize the women's clinic too?
Like,
Maybe for a program that is like FEOB.
yeah, so yeah, you can modify your list, and that's the beauty of having your talking points. You can modify them. So you can say when you say I see clinic patients, I see clinic patients coming in for all types of complaints, including women's health. Yes, absolutely. So and so yeah, when you're developing your talking points, you're going to be thinking of stuff like that. So excellent. So you're going to reach out, you're going to text me, and you're going to set up a time. And before that time, you need to have prepped for these 10 questions. And when we do our sessions, it's going to be like a mock interview. We're just going to ask you the questions, and we're going to see how well you perform. Okay? And you need to practice. You need to practice this stuff. So again, I've seen with previous APs where they'll be like, yeah, I'll just show up and do my best. And it's like, yeah, that's not good enough. Like, that's not good enough. You can't do that. Like, if you've never failed in the match, fine, okay. But like, if you applied for the match last year and didn't match, you can't afford to do that. You can't afford to be like, yeah, I'll just walk in and do my best. You can't do that. So anyway, when we do our sessions, before our session, you need to have prepped. You need to have studied your talking points. You need to make sure you have this list down cold, and it needs to be part of your talking points. And we'll practice, okay? And the way it goes is that there's no limit. There's no limit on the number of sessions. So we can do this from now until match day. There was one gal, man, dude, she had so many sessions. Like, I couldn't believe it. I thought she would get sick of me, but no. Oh my God, she must have had like literally a dozen sessions. I couldn't believe it. She actually matched her radiation oncology. You guys remember Dr. Leafy?
Yes.
Oh, Dr. Leafy, man. Oh, she was relentless. She was relentless. I was tired. I was tired by the end of it. Anyway, she matched her radiation oncology in New York, actually. So good for her. Yeah, she was relentless, actually. And that's what you kind of have to do. So anyway, let's see here. So, okay, so that's what we're gonna do, okay, guys? So again, after tonight, not tonight though, not tonight, please, not tonight, but starting tomorrow, text me, and then we'll start setting up sessions, all right? And like I said, for those sessions, you need to do your homework. You need to have prepped, you need to have studied your prep, you need to have had this list, you need to have this list down cold, and it needs to be part of your talking points, okay? All right. Before moving on, any questions? Okay, guys, we have, oh, sorry, Dr. Ishra.
Can we have more than 3 talking points?
Very interesting question. More than 3 talking points. What do you guys think? What do you guys think?
I think if they are concise and succinct, 4 to 5 talking points would be.
Let's put it this way. If you have a question here or there, that's 4 or 5 talking points, okay. But if all of them, but most of them should not have more than 3. Let's just put it that way. Most of them should not have more than 3. I think this happened with Dr. Leafy. Dr. Leafy, she prepped for like 25 questions. I'm like, no, Dr. Leafy, no, don't prep for that many questions. Don't make it harder. Don't make it harder than it needs to be. Make it easy, okay? Remember, you don't want to, you're going to study your talking points, yes, but don't make it hard. It needs to be easy, actually, so that you can really study it in like an hour or so. So really try to make it 3 talking points. Try to make it 3. If you really can't help it, okay, but really try and make it 3. This needs to be easy. It needs to be something that you can review quickly, in like less than an hour. All right. So that's an excellent question. And that, what do you, but I mean, what do you guys think? Okay, so that's a good question. Any other questions? Anybody? No? Okay, so if there are no other questions, let's move on to the next thing. So just so you know, we're not going to prep for this necessarily, but just so you know, always have questions. So now before we go into this slide, we've been doing this for about an hour now, you guys. Let's take a 3-minute break and let's resume in 3 minutes, okay? Just to give people a break. We'll be back at 9:10. Okay, guys, let's go ahead and let's finish, I think. So, okay. So let's continue on. So this next thing is, you know, they when during the interviews, what they will do is they will ask if you have any questions. So the big thing is the answer is always yes. You always have questions. So if they ever ask you, do you have any questions? You should not say no, I don't have questions. And you'll probably have time for like one question, honestly. One question, maybe a couple questions. For those who have had interviews before, how does this usually go?
I had an interview with the program director, and immediately he just kept asking me if I had any questions. Like he didn't ask me anything else, but for me to ask him questions right from the beginning.
Interesting. Was that the program director?
Yes.
It's true. It's true. What about anybody else? Anybody else have anything similar to that?
Yes, after a particular interview last year, the program director is actually the APD, and then she said, "Do you have any question for me?" And I said, I've all the questions that I have was answered during the presentation. But then I met with the program director recently, and then she said, "Don't ever say you don't have a question."
That's right. That's right. Yeah, you always have a question. Always have a question. Exactly. Exactly. Well, good. Anybody else? Anybody else have any experience with that that portion of the interview? Okay. So a lot of times, yes, it's not uncommon. So like what Dr. Ike said, you never say, I don't have any questions. You always have questions, okay? Now you don't, it's not like you have 10 questions. You're gonna have one, maybe two. It's not really gonna be a lot. Now in the case of Dr. Israel, actually it was a lot more than that. Now in Dr. Israel's case, it's not unusual for programs to have one person who's really not there to interview you. That person is there just to tell you about the program, honestly. And that will usually be someone senior. So sometimes like the department chair, or maybe like the program director, and they'll leave the real interview to somebody else, actually, like to an assistant program director or faculty or somebody like that. And the more senior person will just be there just to tell you about the program, answer any questions that you have. So it's not unusual to have Dr. Israel's setup where one person the whole time, that's all they do, and it's all the other people that are doing the real interviewing. So basically, all that is to say, you need to be ready. So what you want to do for this, it's fine to have a list of questions typed up and ready to go in your folder, because you will go with a folder, right? Right, guys? You will go with a folder? Yes? You're going to go in with a professional folder, right?
I don't know. We have been doing virtual so far.
Oh, well, that makes it easier then.
Mhm.
Yeah. Excuse me. So if it's virtual, that makes it even easier. So so you should have it. So you should have that list ready to go then, actually. So so always have you can have that list in front of you, so you don't have to remember it. Even if you're in person, does anybody do any in-person interviews then anymore, or what? Guys?
Most programs are doing virtual, but I heard that some family medicine program are giving people the option of choosing either in-person or virtual.
That is an interesting question. So so if do you guys have a lot of that where they give you the option?
No, the interviews I have for now, they didn't give me the option. It's just virtual.
Oh, okay. All right. So in that case, if most of the time it's virtual, this should be fairly easy. You should have questions ready to go. All right. And like I said, it's really only going to be one, maybe two. So always have questions, have it typed out and ready to go when they ask you. And it's fine if you look down and look at it. I mean, there's no problem with that. When I interviewed for residency, I had that list in my folder and I just took it out well, I didn't take it out, but you know, I looked in my folder and I said, you know, I've got some questions typed out. Is it okay if I refer to it? And they say, of course. I mean, what are they going to say? No? They're asking you if you have any questions. They're not going to tell you no. So I would like look and I would, you know, I would just ask a question. So always have it. Now, you can tailor your questions to the person you're talking to. So if you're talking to the program director, you can ask about the history of the program, the direction of the program. Are there any major changes in the rotations or the curriculum? Are there any changes in the sites of the rotations, or are there any new rotations? You can ask them even questions like, where have previous residents gone to practice? Have previous residents gone to fellowship programs? You know, you ask those big program type questions, basically. For the faculty, they're the ones that are going to be like with you, like precepting you, and they're going to be working with you very closely on patient care. So you can ask them, you know, you can ask them things about, you know, like what do they like to see in a resident? You know, what are some characteristics for success? You know, what advice would they have for an incoming PGY1 candidate? So things from the perspective of a faculty person, you know, when taking care, you know, when taking care of patients. You know, from the residents, you can ask about what's it like being some questions about what it's like being a resident in the program, such as, you know, can you tell me about the general residence experience? Do you feel like you have an adequate balance of teaching and clinical care? Do you feel like you have enough support while on call? Those are some questions you can ask about, you know, ask of residents. I would avoid asking about time off. You know, I mean, that's just me. That's my personal thing. It's like who cares kind of thing. Like, I would avoid asking about time off and ask about vacation and, you know, ask about sick days. That stuff you can find out in other venues. It's not that it's not important, but, you know, you don't know how that'll be interpreted. So I would avoid questions like that. What do you guys think? What are some questions you might ask of these people?
To the other residents, it could be like, how far do you live from the hospital, or how the schools are, or what do you do what do you do to get together sometimes?
Yeah. Oh yeah. Social events. Yeah, you can tell I'm not social. So yeah. So the resident is the one most likely to ask you about what do you like to do for fun. They'll ask you, what do you like to do for fun? That's definitely, actually, that's one of the questions here to prep for. Oh, where is it? Oh, here it is. Stress, maintain balance. That's number 9. So a resident is most likely going to ask you this, man. But yeah, no, excellent question. Excellent point, Dr. Ishraf. Yes, Dr. Amata.
Yeah, I think for the faculty, you want to ask about time, how short the time for feedback, as in after the residents do some of their rotations, their feedback.
Yeah, that's an excellent question. What is the feedback process like? Would I expect to receive feedback, you know, in real time as I'm taking care of patients, or would this be something that I would wait for a one-on-one with my advisor, because everybody gets an advisor? Excellent question. How is feedback given? Excellent question. Yes, Dr. Ike.
So for the residents, you could ask them that, what is a typical day like? Or you could ask them that, what challenge did they face as a PGY1 and how were they able to overcome it?
Very interesting. Very interesting. You know, the thing about the PGY1 and challenges. I might reword that a little bit because it almost sounds like you're interviewing. It almost sounds like you're interviewing them and not about the program almost. It's like, tell me, what challenge do you face and tell me how you overcome a challenge. I might reword that a little bit. I might say like, what are some typical challenges that interns face in the program potentially? Or maybe even make it a little, the word challenges makes me think a little bit. I wonder, I think you might even make it a little bit more general, how, help me out, guys. How would you word that a little bit? Maybe instead of challenges, what are some common,
challenges during residency or during your first year?
Yeah, maybe what are some common, maybe not ask about maybe don't pin it on somebody specifically, like what challenges did you face? That's a little too off-putting, I feel. It's like, just like what Dr. Wad said, like, what are some typical challenges that an intern would expect, to really want to work on, or that might be something, as an intern, what do I need to make sure I need to work on to succeed? That you want to keep it positive a little bit. Keep it positive.
Okay.
So I wouldn't be like, what challenges did you overcome? I'd be like, what are some things if I'm fortunate enough to, come to this program, what would be some areas that I really need to focus on to succeed? That's a good one. I like that one.
Okay. So I had asked a faculty last year that based on I said, based on your experience working with residents, what do you think is the most challenging part of the intern year? That was what I asked her. And then she said the EMR. And then I responded by letting her know that I've actually worked with some EMRs before, like Epic, and she said, oh, they use Epic. So that was where I asked her, but I'm just thinking that could that question majorly be for a resident? So that's why I'm trying to like kind of refresh it this time, that if I have encounter with a resident, maybe that's a question I should ask them.
What was the question again, Dr. Ike, that you asked about?
Like the one I asked the faculty member, I just asked her that based on her experience working with intern, because she said she's the one in charge of outpatients. So she's one that mentor residents when they're on outpatient rotation. So I asked her that based on her experience working with residents over the years, what is the most challenging? What is most challenging for intern when they start their rotation? She now said, oh, most of them is EMR and they get training when they come into the program and all.
Yeah, that's a reasonable question, I think. Yeah. And it sounds, that sounds like a reasonable one for faculty. And it's good because it opened up the opportunity where you can highlight about yourself, your experience with EMRs. So that sounds like a very positive interaction. Did you feel like it was a positive interaction?
Yes, I did. In fact, when I saw her this year at AAFP, she remembered me. She even put out the email I sent to her before I could put the email out. She's like, I remember you so well. So.
And maybe this year you'll indicate, well, I'm an assistant physician now, and I do all this stuff, so that should be helpful. Dr. Wad.
Yes, quick question. So some programs, their faculty do research, the residents do research. Is it okay to ask questions about their current research?
Yeah, absolutely. In fact, that's, because their research interests are often available online. So you can actually get an idea of what their research interests are. And it's possible where you can incorporate that in your question, especially if you know who your interviewer is. So this is really something else that really wasn't on the slide that Dr. Wad really points out, is that a lot of times they'll give you the itinerary of who's going to interview you. And even if they don't give you the itinerary, you can at least look up who the faculty are. And potentially you can see their, you see their clinical interest, their research interest. And so when you ask questions of maybe that faculty member, if you know what their research interests are, you can say, well, Dr. So-and-so, I understand that one of your clinical or one of your research interests is women's health, for example. And this is an area that I'm really looking forward to developing in, and I would really look forward to the opportunity to maybe participate in some of the research activities that you have going on. Would this opportunity be available? And that would be a question for that faculty. It doesn't have to be that, it could be something else. But yeah, absolutely. And when you do that, you've done a couple of things. Number one, you're asking them the question, but you are highlighting the fact that you did your homework, like you're someone who does their homework. They like that. You're also talking about them, and they like that. They're like, oh, they're talking about me and my research, and oh, this is great. And so you're massaging the ego a little bit. And then you're also indicating that you're interested in research. Like they didn't ask you, you're asking the question, but you're still able to highlight about yourself. So see, you did three things. You highlighted that you're someone who does their homework. You showed that you take interest in their research and take interest in them. You show that you have an interest in research in general. So these three things you've done just by asking that. So yeah, absolutely. You should try to research the people who are interviewing you so that your questions can be tailored to that person. So that should definitely be part of how you prepare for the interview. Is like when you come up with your list of questions, your questions reflect what you've researched on the people who are interviewing. So, excellent question. Anybody else? Any other questions on this part? No? Okay. And like the thing about interviews too, sometimes it takes every ounce of preparation to barely get it. You see what I mean? Like you prepare, right? And you prepare as best as you can. Sometimes like it takes every last bit of preparing to barely succeed. Like if you don't prepare at all, you may not get it. But if you prepare and prepare, it may be enough for them to rank you highly. So that's why you need to prepare as best as possible, so that you give yourself every chance to be ranked highly. Okay, so then the other concept is everything is an interview. Everything is an interview. From the time, every email that you send, every interaction you have with the receptionist, with the administrative assistant, every interaction you have with like anything, even if it's during lunch, if it's during the session, like the social settings before or the social things after the interview day, they're all interviews, okay? So the pre-interview dinners, the lunches, all of it. You want to be very nice to the administrative staff as well. Don't be jerks. Do not do that, because they will be very quick to tell the residents and the faculty that this is a bad one, okay? So you obviously want to be very nice, very respectful, very humble with everybody, and especially like with the administrative support staff. Yes, Dr. Wad, you had your hand up?
Yes, quick question. So there are some of the interviews are virtual, but sometimes they do like what do you call it? A meeting. They show the faculty like 1 month before ranking, like in January. It's like on site. And they do mention it's not important for ranking or like for the match, but like they invite us to go there to see the place and meet with the faculty members and with the program directors. How important it is to go there and meet with them and talk to them if they say it's not important?
But I would say that some of these functions are a little bit more, they've become a little bit, they've developed more so than from the time I interviewed. Actually, my interview was 20 years ago this cycle, actually, 20 years ago this cycle. So that's quite a while ago. So things have developed quite a bit. In my day, it was just a pre-interview dinner and that was it. Like there was nothing else. But now there's more functions. So I would like to invite the other folks today to kind of comment on their experience and their opinion. You know, do you guys think that these like the function Dr. Wad explained, do you think that that's important to attend?
Yes.
I think yes, they are important. But they say it's not important, but I think it's kind of a second look. So I think it is important to attend. Possibly in person would be best. They give options sometimes, both the options of virtual and in person. So I think the in person shows that you're really interested. That's what I think.
Somebody else jumped in as well. I'm sorry, somebody else said something too?
Yes, I just said yes, that is important.
Okay, would you like to elaborate, Dr. Ike?
Yeah, I would say it's important for some programs, not all programs, to actually go. You never can tell the direction it will go. I've heard an experience of at a program where somebody went, though that program did not request for a second look, but the person just decided to go. And when the program director saw her, the program director put her down the list. Just seeing her in person, they didn't like her compared to, and she has already done an interview. She was part of their first on their rank order list, and that experience just dropped the girl from the rank order list. So it depends. Some programs they believe that if you come, it shows that you're really interested in them. And that could also make them like consider the person by the time they are ranking. And some, like there's a program I interviewed last year, they specifically said that they are going to be inviting people for second look after they have already submitted their rank order list, so that is not going to affect their judgment.
But
that's why I said it depends.
If I understood you right, that example that you gave, it was someone who interviewed, did well, came back for another visit, did poorly, apparently. And
no, the interview was virtual. But she requested that she wanted to come for a second look. So I think during a conversation with them on a second look, something went off about her that they didn't like. So they dropped her off the rank list.
Interesting.
So that's why I said it depends. Like you never can tell how it will go.
Interesting. Yeah. Okay. Yeah, I mean, so I don't have as much standing on the question as Dr. Ishraf and Dr. Ike. But I mean, generally speaking, when you're present, it shows you're interested. And I think from my standpoint, it's an opportunity to highlight the assistant physician thing a little bit more from my standpoint, because it's maybe, I'm guessing it's not as formal, so you can just sort of talk about it. You can talk about these are the things that I do. Again, you have this list in mind. These are the things that I do. I still volunteer. I'm still going. Oh, I saw this patient last week. Oh, this is what was going on. And oh, I love this. I love family medicine. Absolutely. So I just feel like it could be an opportunity to reinforce the assistant physician experience a little bit more. Something else too is, this year we branded this Bridge to Residency program. I mean, it's always kind of the same thing, but I like to say it's a Bridge to Residency program specifically. And, I think when talking with programs, it's not, maybe not a bad idea to call it, because that's what we call it, and that's what it is on the website. So, and that's what I say in your letters of recommendation too, by the way. So it's a bridge to residency program. So when you say that, it's like, oh, wow, bridge to residency. Oh, that means you are prepared. That means you're having good preparation for residency. So that branding may be helpful too. So, I think a second look, maybe an opportunity to talk about the experience a little bit more, talk about bridge to residency a little bit more, and that might, because sometimes people, they don't understand the assistant physician thing very easily. So another opportunity to reinforce that may help you, basically. So, okay, good. Any other questions? Any other questions on this?
Some people don't understand assistant physician. Is it okay to mention like mid-level provider? Is that something?
Yeah, I think so. And I think for me, anytime, like, you can say mid-level provider, but I would quickly go into this list, because what's the most important thing is that they understand what you're doing. So they need to understand that you are seeing patients independently. Of course, it's as a mid-level provider, yes, but technically it's independent. Like, you are prescribing, you are ordering, you are referring, okay? You are seeing patients and doing their notes. You're following up on results. Like, you, in your explanation of an assistant physician, you need to quickly go into this list of what you're doing. You need to say, I prescribe it, I do it, So that will help them. And yes, I like what you said about mid-level provider. I think that combined with quickly going into this list, that should help explain what you do.
Sure. Thank you.
Sometimes the hardest thing is to explain what you do. It's not easy, actually. If any of you guys go into administrative medicine, you'll have a very hard time explaining what you do. People, all they understand is doctor. Like if you say, well, I'm an associate chief medical officer, they're like, what's that? So you're not a doctor? So it's like, no, I work as an executive for a big hospital system. It's like, oh, so you're not a doctor then? So like, it's so hard. Actually, to be honest, even when I started as faculty in Kansas City here, even that people didn't understand. So then they're like, oh, so you're a doctor? It's like, well, yeah, and I'm faculty of the residency program. I work with residents and fellows and medical students. And they're like, oh, so does that mean like you teach them like in a classroom then, like on a dry erase board? And it's like, yeah, it's like, forget it. Yeah, sure, I'm a doctor, whatever. So anyway, but actually, joking aside, it is true. People will have a difficult time understanding. So you want to think carefully about, how do I explain it in ways they understand? So the assistant physician, you can say that this is, I think, yeah, you can explain this is a license for medical school graduates before residency, like a mid-level provider. And with this license, I'm able to see patients independently in a clinic. I commute to a clinic once a month, but I see patients. I sign off on their notes. I prescribe the medications. I order labs, and just go through your list. I think when you need to look for an opportunity, and I think if they ask about the assistant physician, that is an opportunity. You need to look for an opportunity to go through this list. Because I believe if you go through this list, it'll be, they have to be impressed. And you have automatically, remember, you want to put distance between you and the other candidates. So who else has this? Not many. Like, who else is an assistant physician that they're interviewing? Probably nobody. So when you go through this list, you will be distinguishing yourself from the other candidates, and that's what you want. So you need to look for opportunities to go through this list. And so, yeah, when they ask you about what is an assistant physician, that's probably an opportunity to do so. So, any other questions? Well,
What about
Can we say,
please go ahead, Aki. Yeah.
I was gonna say, instead of mid-level, can we say limited license physician?
limited license what?
Physician.
Well, people know mid-level. When you say limited license physician, I mean, yeah, but mid-level people know. People know what that is. And you want to talk in the terms people know. So
Okay.
it's a type of mid-level provider. That's how I would describe it. If you say it that way, people are like, oh, okay. If you say limited license physician, it's still like, okay, well, what's that? You know? So I do think, so when you say mid, it's like a mid-level provider, that automatically says that it's limited license physician. It automatically says that. But still, you need to go into this list quickly. You need to quickly go into this list. Regardless of what you call it, mid-level provider, limited license, whatever you call it, you need to go through this list, basically. Okay? And remember, when you go through the list, you're doing eye contact, you're smiling and standing up or sitting up, you're sitting up straight. Okay? All right, you're not just reciting like a test or something. You are communicating. You are communicating this stuff. You need to communicate. All right. So you're going to go through this, and you're going to have great nonverbal communication while you're saying it. Okay. Okay. So
I had a question regarding humor.
Oh, yeah.
How much humor is good and
Like
is
what?
having it like humor while interviewing is like having some humor shows that you're like you're fun to be around, something like that.
Okay, do you have like an example?
Nothing comes to my mind, but I just heard in some of the YouTube videos that add some humor to your talk.
Yeah. What do you guys think about that?
Well,
Depends on the situation,
Funny?
topic, and the personality and how you're presented.
What's that, Dr. White? I'm sorry, I interrupted you.
It depends on the topic and how good at you can present it.
So if I heard you right, it depends how you present it, is that right?
Yeah, I mean, you could think it's funny, but if you don't say it the right way, they will not understand it's in a humorous way.
Yeah. Anybody else? Anybody else have any comments or opinions on humor during the interview?
well, my wife always says that I'm not funny. So I'm just going to try to avoid all the jokes. Often I find I make people laugh when I'm not trying to. So I'll just leave it at that.
Anybody else? Any other opinions?
This is an example of humor. What Dr. Ueda just told is a good example of making a humor.
Dr. Jamie?
Honestly, I feel that humor is a very good tool to use, but if it is not, it can go either ways. Sometimes it can mess it up if it is not taken in the right way. And for an interview, I believe it should be professional, but it depends on the other person who takes it. And often we don't know much about the other person. I love to be humorous because when I'm nervous, I'm automatically turning towards humor, but then that can land me into trouble too. That's my experience. Because I can talk a little too much too, and I never know how the other person perceives it. So I believe it's a double-edged sword, kind of that.
Yeah, I would pretty much agree with everybody. I would agree with Dr. Wad that, you know, it sort of depends. It sort of depends. And I would especially agree with Dr. Ueda where you probably want to let it come up organically. You don't want to inject humor purposefully because you're there for something serious. And when you're there for something serious, I think part of being a professional is, you know, you're focused on the purpose of it, and you're doing it in a very positive way. I think the overriding mood should be positive, optimistic, enthusiastic. Those are the things that really need to come out. And you're doing it for a serious purpose, but you're doing it with a smile. You're doing it with ease. You're doing it with confidence. You're doing it with positivity. Okay, that's how it really needs to come across. Communicating well. Okay, and so you don't want to purposefully, like, you're not really looking for opportunities for humor. You're looking for opportunities to go through your list, you know? You're looking for opportunities for that. And when you're saying it, you're going to be doing it with confidence, with ease, with a smile, you know, like that. And then if anything humorous does happen, it's secondary. It's secondary. And just like Dr. Jamie suggested, that it can be a double-edged sword, you know? It's not anything where you want to be careful too, because sometimes jokes are offensive and you really don't know what people get offended by. I think that's another pitfall. So yeah, no, I would agree with everybody on those things. And a part of me too says you want to let the senior person be funny. Let the senior person be funny. You know, if the person interviewing you wants to be funny, great, laugh at their jokes, you know. But let the senior person kind of do that. And if there's anything else that happens, just let it happen. Let it happen. You know, like Dr. Ueda said, it's almost like it's humorous, but you're not trying to be a comedian necessarily. But you know, and you can acknowledge humorous things. You know, you can acknowledge, and I think that's important too. Like something is kind of humorous, you're like, oh, that's so funny, you know. So you can acknowledge humorous things without really trying to be funny. You know what I mean? So that's how I would go about it. So I would agree with all three of them. So yeah, that's a good question. Okay. Any other questions here? No? Okay. So then there's this last slide, which is sort of other things. So just from personal experience, make sure you sleep well. Don't sleep 3 hours or 2 hours the night before an interview. Like, I know myself well. If I don't sleep well, it's a disaster. The reason it's a disaster is because, remember, interviewing is all about the nonverbal communication. And like, for a lot of people, if you don't sleep well, it's not so good. Okay, like I can tell you, like if I don't sleep well, I'm more irritable for sure. Like there's some things I miss. I don't catch things. I want to smile, but you know, it's not as easy. And like when you're tired, it shows. Anyway, I'm sure you guys probably already know this, but I'm just saying, just make sure you sleep well. Has anybody ever done an interview with like no sleep? Well, good for you. Good for you. I made that mistake once. Actually, because you know you're thinking, oh, I can stay up. I've got energy. Interview days are long. They are long days. And I remember I had an interview. I slept for 2 or 3 hours before an interview. And the real interview was right after lunch. They had some fluffy thing in the morning. It really wasn't I mean, that was like nothing. But the real one, the real person was right after lunch. And what they did, it was right after lunch, and then they had us sitting down for a long time. So I was about to fall asleep. Oh my God. I couldn't, like, I had a hard time staying awake. It was a disaster. It was a disaster. And then, like, it was like, I'm thinking, oh, I'm strong. I can stay up. I do this all the time. And then, okay, fine. Had the interview just been in the morning, I would have been okay, actually. But no, we had lunch, and then we sat down, and I could hardly keep my, and then like, oh, it's your turn. And it was a disaster. Like, I couldn't answer the questions right. It was a disaster. Anyway, that's enough about that. It sounds like you guys don't have that problem, so we're good. So moving on is off the wall questions. So once in a while, people will ask you like weird questions, like if you were like a bird, what kind of bird would you be? Or when you look at a billboard, what do you think of? Like weird questions. Have you guys ever had that? During one of these sessions, I don't know if it was last year or the year before, somebody had something like that. Anybody ever have any weird off the wall questions?
Yeah, I had an interview question where they asked me to name something that I really hate. And it was an interview with 3 other people at the same time. And I said, belly button lint. And the lady looked at me, she said, you're going to regret your answer. I said, okay. Then after everyone answered, they said, okay, now say something that you really like about what you said you just hate. And I said, well, if you ever get a lot of lint, it's kind of cool. Like when you peel that thing off of the, the little screen from the laundry, from the dryer, it's kind of this little blanket that you made. It's kind of neat. I think I was the only one who turned it around that way, because everybody else said, oh, I hate liars, I hate cheaters, and it's hard to turn that around. But lint is,
Oh, very interesting. Very interesting. Yeah, you're such a good guy, Michael. You're such a good guy. So I would say my suggestion for these off the wall questions is try and tie it to patient care somehow. That's my suggestion. So remember, when you're interviewing for residency, what you care about is great patient care in whatever specialty you're doing. So that is an excellent example. That is an excellent example of an off the wall question, Michael. Now, let's take that same question, actually. Let's take that same one. So something you really hate, try and tie it to patient care. How would you do that?
Oh, something that you really, well, I guess if you're taking, maybe if you're taking a history and somebody can tell you a story instead of just sort of answering the question, that could take a lot of time when you're taking a personal history. I don't know.
So
What if
sorry, somebody
kind of like
something came to mind? So what if you say, I'm just thinking, what if you say a non-compliant patient, but then I have come to realize that the only reason the patient is non-compliant is because they are not well educated on their health condition. And what I have done is to take enough time to educate my patients on how to take their medications, if there is any help they need, if it's about adjusting the dose or the time of the day taking the medication. That will also help to improve health outcome. Another thing that I've also noticed is maybe there are other factors that could have affected the patient's reason for not taking the medication if it's too expensive, or maybe they don't have a job. And that is why I volunteer in places where some people are suffering from, they don't have enough food. So if you don't have food, how do you want to buy medication? So I've been able to address my patient health concern beyond the clinic walls by offering them food stamps, letting them know where they could get free food. That could also help them general health.
Yeah.
Maybe something like that.
Oh, that's much better than what I was going to say.
Now we're cooking. Yeah, now we're cooking. So and the nice thing when you tie into patient, like especially that question, that's a very interesting question because you can easily find something that you like about it. So like, so to take Dr. Ike's suggestion, so something you really hate. Well, I really hate it when patients are found to be non-compliant and it has an adverse impact on their care. That's something that I hate. Okay, now what's something you like? Well, what is something you like about it? Well, when I have these situations, I find that there's an opportunity to address the underlying reason for their compliance. And it could be related to, you know, affordability or other social determinants. And that's something that really inspired Dr. Ike. She essentially took it to another level, actually, saying that, you know, and actually that inspired me to volunteer in places where I can address some of those social determinants. So hopefully have a positive impact on my patient's care. That's how you answer it. Okay, that's how you answer that question. So if they so off the wall questions, tie it to patient care somehow. You know, if it's like when you look at a billboard, what do you see? You know, anybody see a billboard today? Driving? Michael, you saw a billboard?
Yes.
Oh, Dr. Ishrat, you saw a billboard? What did the billboard say, Dr. Ishrat?
It was about some 2.4 of the fuel one.
The fuel, like the price?
Uh-huh.
Oh, yeah, okay. So okay, so fuel price, how would you tie that to patient care?
I don't know. I cannot think of.
Well, so this is another thing, by the way. If ever you get an interview question, let's say you don't know the answer right away.
Okay.
There's a couple of things you can do. Try and put some space. Try and just pause and think for a second. Okay. This is just in general, not just for this. Well, maybe especially for a question like this, but just pause and think, just like, and just think. Okay. Don't be afraid to take time to think. I know, like, personally, I need to be careful not to just blurt stuff out because you're like, oh, I need to answer the question. Let me just answer the question, you know? But just be careful about that. Try and take some time to think. Another tactic during an interview too, which I just want to mention, is that if you're not sure what they're asking, try to verify that you're answering like their question, or at least make sure that you're understanding their question. Maybe you're going to say some talking points, but at least make sure you understand their question. So one time I was in an interview and they were asking me a question and I'm like, I'm not quite sure what they're asking me. I think I know. So then I started to answer it, and then I paused and I said, okay, so I just want to make sure, is this a good example that's answering your question? And then he's like, yeah, it is. I'm like, okay, perfect. Well, let me continue then. So that's another thing that sometimes if they ask you, I think usually you'll understand the question, but sometimes it's worded in a funny way where you're not sure you're understanding. Feel free to clarify, you know, like, and make sure that like, for example, if you start answering it, you can pause and be like, I just want to make sure, is this answering your question? So feel free to clarify and confirm that you're understanding the question and that you're answering their question. And if there's something you're not quite sure of right away, take some time to pause and think. Okay, so that's all okay to do. All right. Who wants to help Dr. Ishrat out? There's a billboard that has the price of fuel. So if someone asks you, you know, when you see a billboard like that, what does it make you think of? How would you tie that into patient care? Who wants to help her out? The price of fuel.
Transportation issue to the clinic.
What's that?
Transportation issue to the clinic.
Transportation to the clinic. Yeah. You could be like, well, that price seems pretty high. If it gets any more expensive than that, I bet you there is a certain percentage of patients that may no-show for their appointment. And maybe when they scheduled the appointment, gas was a certain rate. And then by the time the appointment day came, the gas price went up. And maybe that's why they no-showed. All right, somebody else had a comment too? Somebody else had their hand up? Dr. Ike.
So I was just thinking that somebody could tie that up to if you have increase in gas price, that means it could also affect food.
Yes.
And you, for patients that could not make it to clinic, you could still do telemedicine with them, but it could also affect them feeding.
Yeah, look at that. So the price of gas went up. It will affect their transportation, and maybe the patient is at risk of no-showing, but I can do a telemedicine visit with them. But if gas is like this in general, I can see that same patient having difficulty making healthy food choices, which may make my dietary counseling a challenge. Dr. Jamie, you had something too?
So when gas prices are increasing and prices on all commodities are increasing, so patient is unable to afford all the medications that have been provided. So we get a chance to give them alternate medications, which are coming under the $4 medication list.
Yeah. There we go. So not only did it affect transportation, not only did it prompt you to do telemedicine, not only did it affect healthy food choices, but if gas prices are going up, that is an indicator that all commodities are going up. And that may cause the patient to be non-compliant for not just attending their visits, not just healthy food choices, but even compliance with medications. And that makes you think, not only may I need to do telemedicine to accommodate this patient, but I may need to think of alternatives such as generics and $4 list medications to help them be compliant. So I see a number in this one billboard, I see multiple challenges that my patients will face every day that will pose barriers to healthy outcomes.
Amazing. That was cool.
You didn't think to get all that from a billboard, did you? Anybody else have a billboard? We could do this all day, but that's okay. We don't have to. So anyway, that is how you can handle off-the-wall questions. Because remember, what do you care about? You care about good patient care. You care about great patient care and great outcomes. That's what you care about. So because that's what you care about, if they ask you an off-the-wall question, you're thinking great patient care. All right? Sound good? Okay, now somebody actually mentioned, who was it that mentioned they were in a group interview? Somebody mentioned that. Was it Dr. Ike? Somebody said that there were 3 interviews. Oh, Dr. Michael. Oh, that was the lint. That was the off-the-wall lint question. So good. So what was that like with the group interview? So tell us about it.
It seemed super awkward because we're all interviewing for the same job and we could hear everyone's answer as they went down the line.
Right.
So I thought, and they didn't let us know ahead of time that it was going to be a group interview. So yeah, that was awkward. Yeah.
Like, did you feel that, so let me make sure I understand. So it was multiple faculty and multiple residents as well, is that right?
Oh no, this was for a bookstore position.
Oh,
this was
for residency.
Yeah, before residency. Yeah.
Gotcha. Good. Yeah. So it was multiple candidates and multiple interviewers, is that right? I see. I will say that can happen during a residency interview. You can have you can have various setups. You can have one faculty, multiple residents. You can have one resident, multiple faculty. So, um, so does anybody else have experience with a group interview? Anybody?
Yes, I had one faculty and 2 to 3 residents.
Really? Wow. So tell us, Dr. Ishraf, how did that go?
It went well, but while the residents were asking questions, we were like keenly observed and we were given points for that. So that's yeah, that was tricky, though.
Yeah. You know, it's very interesting. I find that these situations, they're like meetings. You know, when you have like, especially as you progress in your career, you know, you get involved in some more administrative things and there are meetings. Maybe you go to a conference, you know, a conference for your specialty, a medical conference or something, and there are meetings. And nonverbal communication is much more important during these group settings, actually, is what I find. Because during a group situation, you're not talking as much, I think. And because you're not talking as much, your nonverbal communication does most of your talking. And so when other people are talking, it's very interesting, Dr. Ishraf. Can you repeat what you said? You said that you were keenly observed while other people were talking.
Yeah, while I was talking to, or like the residents were asking me questions, and then I was answering. So like that was everything I was talking to the residents was also, it was not casual, it was formal interview.
Yeah.
So usually in different interviews, like residents speak in a different setting. So you're very casual with them. But there was one interview where one resident and one attending and 2 residents, and then in the same program, another attending with 3 residents.
Yeah. And you were saying that even if you weren't talking, you were being keenly observed and assessed?
No. Even when I'm talking to the residents, that's added as a point, like the attending was writing down the points. Yeah, whatever she's like. Yeah.
Gotcha.
Yeah.
Okay. So I
Yeah.
think with group meetings, like you want to be, even if you're not talking, okay, even if you're not talking, you want to be engaged and you want to be, you know, you still want to be sitting up straight. You want to have, you want to be smiling. You want to be positive, you know, even when you're not talking. I just think that that's very important during a group setting. And that's really the only thing I would say about that, actually. Like your nonverbal communication becomes really important. And I think that what, you know, if you know, if you're being questioned and you're answering, that nonverbal communication is really important because now you're reflecting on multiple people at the same time. So it's an even bigger impact. So if like if there's very bad nonverbal communication, there's a bunch of people that now have a bad impression. You see? So I just feel like in these group settings, whether you're talking and you know, whether you're talking or not, your nonverbal communication needs to be excellent. So that's really my big thing there. And you want to be very gracious. You know, you want to be very, and I'm sure you guys would be, but you know, you want to be gracious. You want to be, you know, polite. You know, considerate as needed. I mean, those are some things to keep in mind. But yeah, that nonverbal communication, especially if other people are talking, like if I'm like not smiling and I look like I'm upset or something, that just looks really bad. And it shows that you're not engaged, you're not supportive. So even when you're not talking, you're still on the camera, you need to be sitting upright, smiling, supportive, that kind of stuff. Okay, positive. Okay, so I just think it's magnified. Okay, it's magnified during a group interview. So that's what I would just say about that. To be honest, good like people that interview very well should do group interviews, actually. They should. Because those, if you're interviewing, you want to do a group because you get better assessments of people. You know, like maybe the person asking you the question, maybe they're a jerk. You know, maybe they're a jerk for some reason, but other people will see the same thing and they may not agree. They may think that you're awesome. So like, yeah, so you make your the impression that you make is just magnified. So just make sure, you know, make sure your nonverbal communication is excellent. So okay, guys, well, I think that's it. Any questions before we wrap up? No? Okay. Well, I said it'll be less than 2.5 hours, I guess. So I guess it is that. Not by much though. So good. Well, I tell you what, we'll post this on YouTube hopefully soon. And what I would say is starting tomorrow, just text me so we can start setting up some one-on-one time. It'll probably be like 1-on-2, 1-on-3 or something like that. And we'll just schedule it. I mean, it'll probably be in the evenings. We'll just try and schedule them. So I'll look forward to receiving those tomorrow. All right.
Thank you, Dr. Murad. That was really helpful.
Sure. You guys
Thank you.
haven't had any interviews yet?
Waiting for one.
Okay, wonderful. Well, I'm sure they'll come. Dr. Wad, I heard you got an interview.
Yes, I did. Yeah.
All right, sounds good. All right, guys. Well, good. Well, let's just be optimistic, and we will stay in touch. So thank you guys so much.
Thank
you.
you. Thank you
Thank
so
you.
much.
Thank you.
Thank you.